In the 10 years up to 2020, we are going to see the largest sustained fall in NHS spending as a proportion of GDP in any period since the 1950s. By 2020, we will be spending £16 billion less on the NHS than we were in 2008 in today's money. As a share of GDP, spending on healthcare will have fallen to 6.6%, with France and Germany spending almost 11% of their GDP on health. As the Financial Times comments, it is little wonder that the NHS lags behind its neighbours in performance on treatments such as cancer care. So next time you hear of the NHS deficits, perhaps it would be more accurately described in terms of underfunding rather than overspending. But what about that £8 billion the government promised by 2020? That is not for any additional services. It is not for improved mental health care or for expansions to A&E, and it is certainly not for any 7-day NHS. Whatever the figure, it was still based on the assumption that the health service could first make £22 billion of efficiency savings by 2020, a task many senior figures in the health service believe is impossible. That means squeezing the NHS further, cutting costs, cutting staff, and cutting the care provided. By the end of 2015, the proportion of patients spending longer than 4 hours in A&E reached its highest level in over 10 years. GP waiting times are rising. Cancer referral times are slowing down. Mental and social health care are collapsing as the NHS is struggling to meet its obligation to patients as the financial squeeze tightens its grip. Mortality. Death rates in the UK are actually increasing in a way not seen since the 1970s. And yet, choices are being made. Choices are being made about how public money is being spent, but the public are not making those choices. The public were never asked if they wanted to starve the NHS of the funding it needs to be able to provide safe care. It is time to call the government to account.